Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Spermatic cord content versus that of the inguinal canal content. So what does it include? First, let's look into the spermatic cord contents. So this includes the testicular artery. The testicular artery, it arises from the abdominal aorta. So this is a abdominal aorta and it supplies the testis as well as the epididymis and the vas deferens. Next is a cremasteric artery. This supplies the cremasteric muscles as well as the surrounding tissues. So the artery of to the ductus deferens. So what are the veins involved in the spermatic content? It includes the pampiniform plexus. This is a spermatic cord. Pampiniform plexus is a vein that networks that drains the testis, epididymis and the vas deferens. Then comes the testicular vein. It drains the inferior vena cava or the left renal vein on the left side. Then comes the nose. Nose is it includes the genital branch of the genital branch as well as the genital femoral nerve, GF nerve, and then the ilioinguinal nerve. Then is the ilioinguinal nerve, it provides a sensory innervation. So the genital branch of genital femoral nerve as well as the inguinal nerve, it provides a sensory innervation to the lower abdominal wall. Lower abdominal wall and the pubic region and the upper scrotum of the labia majora. Now what are the muscles it supplies? Muscle is, there includes the cremasteric muscle. Cremasteric muscle is the thin muscle that surrounds the spermatic cord and the testis, and the genital branch of genital femoral nerve innervates it. Genital branch of the genital femoral nerve. Now what are the other structures involved? The other structures is the vas deferens. That is a muscular tube that connects the sperm from the epididymis to the ejaculatory duct. Next is the lymphatics. So lymphatics drains the external to the and the internal iliac nodes. So external and the internal iliac nodes it connects. Now let's move on to the inguinal canal. So inguinal canal, it includes what are the arteries? Inguinal canal contents. The arteries is the inferior epigastric as well as deep circumflex iliac artery. So inferior epigastric is the artery as well as the deep circumflex artery. So inferior epigastric artery, it arises from the external iliac artery and supplies the anterior abdominal wall. So inferior epigastric artery is the anterior abdominal wall it supplies, and then comes the deep circumflex iliac artery. It arises from the external iliac artery and it supplies the iliacus muscle and the inguinal ligament and also the iliac crest. Now what are the veins? The veins of the inguinal canal content, it includes the inferior epigastric. So inferior epigastric vein, and it drains into the external iliac vein. Next comes the deep circumflex iliac vein. Deep circumflex iliac vein, it drains into the external iliac vein. Then comes the nerves. The nerves is it includes the ilioinguinal nerve. That is, it provides a sensory innervation to the lower abdominal wall. Also the pubic region and the upper scrotal or the labia majora. Next is the iliohypogastric. So iliohypogastric nerve, it provides a sensory innervation to the lower abdominal wall. To learn and grow daily like this, please do subscribe.